I am delighted to welcome to the broadcast Congressman Joe Sestak. Congressman Sestak is serving a second term in Congress, and he's a man who's worn the uniform in great service to the nation, a 31-year Navy veteran. He was a 3-star admiral, and by the way, he's having a hoot, I suspect, running against the newly Democrat. Is that the way to say that? Newly Democratic? No, that's not right. He's a recent Democrat, Senator Arlen Specter, a long-term Republican in the race for the Senate seat in Pennsylvania. Congressman, it is great to have you with us here on the Lou Dobbs Show.
Lou, it's great to be aboard. Thanks a lot, and please judge Joe.
Okay, well, I appreciate that. I'm sticking with Congressman. I know Admiral's got a higher rank, but as far as I'm concerned, I'm sticking with Congressman. It's your current title. Listen, that's out of respect to both you and the institution. But I appreciate the thought. You announced your Senate candidacy. Senator Arlen Specter in these town hall meetings has been looking like he is utterly lost. He looks utterly elitist. He looks utterly confounded. And now we hear the president's going to show up next month for a big fundraiser for Senator Specter. I got to say to you, I like your chances right now, Congressman. Well, I liked them better when you were there. Well, I guess I said something. What are we going to do here, folks? You got an answer? We got folks scrambling. We got people scrambling. We're going to find out. But I was serious. When I talk about Sestak's chances against Specter, they're really remarkable. I understand you're back with us on the phone here, Congressman.
I am so sorry, Lou. I'm on my way to center of Pennsylvania to talk to a great group after I left Philadelphia. But I love my chances. I would not have gotten
You heard that part, didn't you? You heard that part, Congressman.
I love being an underdog. It was in my first race. I'm a Democrat. I ran against a 20-year incumbent in a district that's 55% Republican, 35% Democrat.
Right.
But here's why I'll win. Arlen's having a hard time because he hasn't been in these counties out here. If he had been, he would have found out that Washington, D.C. was not focused on the working family. He would have found out that they had lost accountability. Look, these people who are coming to town halls, they're not crazy. They're people who are just frankly Americans who have lost their trust in government. And they say, you savage recession, Arlen, and Washington, D.C., and now you're telling me, as I'm barely holding on to my health care plan, you're going to try to reform it? Oh, reform it we must so that they can keep it. But that's why you see the anxiety out there. No, I'm in this because Pennsylvanians need a new type of accountable leadership.
Well, you and Specter both support a public option for health care. Now, the president has suddenly decided, maybe that's not so interesting, maybe it's not so necessary, not essential or deady, and no one knows where the White House is right now. But what we do know is the House produced 5 pieces of legislation, some of them related, some of them not, all of them about health care. The Senate has said point blank, there will be no public option. This has been basically, for me, Congressman, covering this has been the biggest charade I've ever seen under the heading of an important national initiative. We have no defined legislation. We have no parameters for health care, quote unquote, reform. And this thing is blown up in this administration's face. And now they're talking about going it alone. Does it get any more bizarre?
Well, Lou, can you hear me now?
I sure can.
Well, let me tell you, Lou, that I am a large proponent of both coverage for all Americans, but also reform. We need coverage for the good of Americans, but we need reform for the good of our economy. And let me tell you why I think the public health care plan is absolutely essential. It's for our economy. Here in Pennsylvania,
you know what? We're on the Lou Dobbs Show. If you can still hear me, Congressman, we're at 2 strikes and you're out. We don't wait for 3. But obviously he's on his way to a political event. His cell phone is gone. He's an interesting guy. The congressman, as I said, he was an admiral in the Navy, and he's talking public option. But let me say, anybody who's wedded to the public option right now, I think you got to really take a big, deep pause and reflect, because there is no way, in my opinion, that the American people are in a mood to trust their federal government with their health care on that level. It's crazy. No. And so I don't know what's going to happen. All right. You know what? You want me to, is he back on the line? Congressman?
I apologize.
Okay. You know what? I said we're actually a 2-strike outfit, Admiral. But you had 3 stars, so we're going to give you 3 chances for each star, all right?
Lou, I apologize. Frankly, apologize.
It's fine. It's fine. What I was just saying is I think anybody committed to the public option here, anybody who thinks, and by the way, I'm very serious about this. I don't think the American people are in a mood to put up with a government taking over health care right now. By the way, I agree with you 100%. I think all of us agree we've got to do something to improve health care. But my God, where have been the public hearings? Where has been the substantive discussion in this country? This is an administration that tried to ram this down the throats of Congress, the Senate, and the American people. And frankly, Congressman, what I think we're hearing in these town hall meetings, you're talking about they're very American. It's very American to tell our elected officials to go to hell, slow down, and start thinking before you start acting, like you've got some sort of great idea here. Because I haven't heard a great idea on health care.
Well, Lou, 2 points. One is I left the military. My daughter had a malignant brain tumor, 4 years old.
Right.
So I only got into politics for one reason, to give everyone the same opportunity she had with her glioblastoma. Everyone should have had the opportunity she did. So, second of all, I believe any legislator who is worth their salt should have been working hard on this thing over the past 8 months, frankly, over the last 2 years since I've been down there.
Right.
Third, and if I could add one point,
sure,
is why I'm a believer that this has to be done is every week, Bethlehem, a city equivalent to Bethlehem, Pennsylvania, everybody loses their private health insurance. The next week it's Reading. The week and a half after that it's Allentown. 14,000 people are losing it every day. And I honestly am a believer in this public health care plan option. One, because it's not subsidized by the government, only by copays and premiums of those who actually choose.
Well, wait, Congressman. Excuse me for interrupting. What's subsidized by? I don't understand that part because I haven't seen any legislation that defines how anything is paid for whatsoever.
Yes, the public health care plan option that came out of my committee in the House, actually has in it a public health care plan option where only copays and premiums are subsidizing that plan. Those who to join it.
And the CBO marked that, scored that?
They said they scored it at $150 billion of savings.
Mm-hmm.
And the reason I want that is because in the Philadelphia region, where 42% of all populations, let me give you a better fact. The Department of Justice says that 94% of all private health insurance markets are in what they call a heavily concentrated market. That is, it's on a watch list because it's getting close to monopoly. It's that way in Philadelphia, area where 42% of the population live. One healthcare company has 70% of it. So all we're saying is, no, it's a private healthcare plan subsidized by your own type of premiums and copays. It's just not going to pay this public health care plan. It's really a private one. Is going to not pay $23 million to the CEO. It's going to hire somebody like the head of Secretary of Defense gets $200,000. Well, we'll hire somebody who cares to run that thing. And it's not going to give $70 million severance pay like just happened to a CEO from an insurance company. It has no advertising. It's a choice. And that's why you begin to get fair competition like we didn't have with derivatives in Wall Street with no referee on the football field. This merely gives us fair competition. It's the only reason to have a public health care plan.
Yeah, and here's where it kicks in though in terms of the public option. Again, the federal government is determining the outcome. And when we look at Medicare, which has over the past 35 years cost about 35% more than every other plan available. We have $60 trillion in unfunded liabilities. We have a host of issues to deal with. There's just no way right now that I believe that the American people are going to trust this government with something so important as their health care without extensive public hearings, without extensive public discussion. Do you?
But Bill, Lou, this bill that came out of my committee is almost a replica of the Massachusetts healthcare plan that has been working for 2 years. And
yeah, but you know that's being criticized. Congressman, you know that Massachusetts healthcare plan is being criticized by even the people who put it into effect.
Absolutely not. 97% of all people are covered. And it is costing a bit more than they thought it would, and it has a problem of not enough general physicians because everybody now gets preventive care, and they're coming in to see a general physician to do that. But overall, the Urban Institute has said, and that's a nonpartisan institute, it seems to be working. In fact, this is the important point that seems, I think, to be, the people don't quite get, is that the government is not going to run the public health care plan option. Yeah. It is not subsidized by it.
Okay, who's going to run it?
A competitor out there. That's all it is, a competitor. And all we say to the other private healthcare insurance companies is there's minimum benefits you have to give, like a mammogram to a woman at the age of 40. And that therefore you cap how much everybody has to pay at $5,000, even in a private healthcare plan, out of out-of-pocket expenses. That's all we do is just set certain minimum benefits.
So let me ask you something.
Competitor out there.
So let me ask you something. Do you truly believe that anyone should trust an administration that demanded on the 1st of August that a bill be passed in the House and the Senate and handed to him for signature without having had substantive public hearings, without having extensive analysis of world healthcare systems? On my show, we've been reporting now for almost 3 weeks on the healthcare systems in all of the developed nations in the world. And we're learning a lot. No one's done that in Congress. No one's done that in the Senate. No one's done it in the White House.
Well, Lou, I cannot speak for everyone, but I will tell you this. Because I got in for health care,
right,
as I said earlier,
right,
I have had a guy on my staff since I got down there who does nothing, well, a little bit after I got there, who does nothing but health care. That's his focus. Mm-hmm. I have studied single-payer systems in other countries like England or Canada, where we subsidize them because they buy our drugs from our pharmaceuticals at 33% of the cost. And I have come to the conclusion that the elements of fair competition, which we don't have now in the insurance companies markets, but transparency within that competition will best discipline costs while mandating everybody has to be in there, Lou. So you get not only everybody covered, but you and I pay, if you're single, right, $400 more for your private health care plan and $1,100 more for your private health care plan if you're in a family of 4 to cover the uninsured today.
All right, Congressman, we are eat up on time. But what I'd like to do is get you back here. We'll talk some more on health care. And is that a man or a woman on your staff who likes to talk health care?
Pardon me?
Is that a man or a woman who's your chief health care advisor?
Adam Exler. It's a guy, and he's tremendous. And
all right, well, tell you what. We're going to call him. I'd like to talk to him, and then we'll talk some more. And we'll just raise hell and kick this bucket called public health care around a lot more because it deserves it. And I appreciate you being with us, off and on, as it were.
Too long, Lou, is we get close to the elections and people are too often in Washington D.C.
Now wait a minute, Congressman, you're not going to disagree. I wish there were an election for you guys every year. Keep it all nice and straight. But I understand your perspective. I appreciate it, Congressman, and I wish you all the best in your Senate race. And like I say, my money's on you.
Thanks, Lou. I'm glad to be coming back soon. Bye-bye.
Bye-bye. And we're going to be right back. Stay with us.